Hello, sweet people. Dr. Poole here. We are doing part 3 of our 4-part pregnancy series. And this part 3 is third trimester, obviously. That is where I'm at in pregnancy. I am 36 weeks. It's very hard to remember at third pregnancy where I'm at, but 36 weeks pregnant, experiencing a lot of fun third trimester things. So gonna share a lot of that and how it relates to our oral health today. So some of the things that I wanted to talk about that we haven't yet covered with pregnancy and oral health is pregnancy tumors. Those are, we talked a lot about gingivitis. Pregnancy tumors sounds really scary. They are not cancerous. They are not a tumor, it's just a growth. And so they are gum growth, usually caused by pregnancy gingivitis. Most of the time it creates an area where you're gonna trap a lot of plaque. And they usually happen in between the teeth. We've seen a couple of them in our office, and they can be really annoying, sometimes a little painful, often bleed when you brush them. They could be pretty small, so you may not even notice them at first, but they can grow. It's certainly something I would recommend talking to your dentist about, because there are some ways that we can help mitigate their irritation during pregnancy. They almost always disappear after you give birth, but they are annoying. So that's something that we often see, sometimes later in pregnancy. So that's why I kind of saved it for the third trimester bit. So yeah, nothing to be worried about. Often go away. Sometimes they do have to be removed if that fibrous tissue does not completely go away after pregnancy, but that's pretty rare. Some other things to talk about that happen during third trimester. Preeclampsia is usually diagnosed or found during our third trimester. So if you do have preeclampsia, you're actually 4 times as likely to have some periodontal issues. And that's because of the blood flow and the reason we get the pregnancy gingivitis and all of those things. So it is something to let your dental care provider know about if you do have preeclampsia. Obviously, there's major concern with preeclampsia itself, but as it relates to oral health, there are some concerns for us too. So we want to make sure that we're giving you the proper home recommendations, and sometimes just seeing you more often. Same with pregnancy tumors, gingivitis, things like that. A lot of the times our recommendation is let us see you and clean and get those areas as healthy as possible during your pregnancy. So again, something to bring up with your healthcare providers and dentists during that time. Something else that's often diagnosed in that third trimester is iron deficiency anemia, sometimes diagnosed in that late second, early third trimester. I have had iron deficiency anemia with all 3 of my babies, and mostly just noticed because of fatigue and the side effects that don't affect my mouth. But what I have noticed, and the more I know about it, the more I realize that in order to get follow-ups and know how your iron is being absorbed, so if you're diagnosed with iron deficiency anemia, they often recommend extra supplementation of iron, which I was doing already, knowing that that was something that I often get during pregnancy. So knowing that I was doing it already and still had it, I just asked a lot of questions to my OB about what's the likelihood I might need an iron infusion and how effective can that be, because I'm already taking a pretty high dose of supplements for iron. And I ended up getting iron infusions this time, which has helped a lot. And the reason it actually relates to oral health too is because it has a very strange side effect with a lot of people, and people who are actually iron deficient in general, not pregnant, can have this symptom as well, and it's ice craving. we have a lot of patients who will be like, oh, I chew ice and feel guilty about it. And obviously we've all been taught like ice chewing's probably not the best thing. Chewing on rocks isn't good for your teeth, surprise. But ice chewing in pregnancy is something that we hear so often. And it can be a sign of anemia. So if you haven't already talked to your doctor about that and are feeling those ice cravings, it might be a sign of anemia. It's also called pica. Even having that ice craving is a form of pica, which is just a craving of a non-edible item. I feel like there was a really cool show on TLC about this at one point, about the strange things they eat. But anyways, that is technically this, something going wrong with your body. You have strange cravings. And it's your body telling you like you need something. And with the ice craving, it's usually iron. So talk to your OB or your midwives about that. Make sure you're getting follow-up iron checks. That's something that like I said, just noticed that I wasn't being offered. So you kind of have to ask. If you cannot cut your ice craving or your ice chewing tendencies, we really recommend soft ice. So think like pellet ice or shaved ice. You really don't want to be chewing big hard cubes of ice. We've seen a lot of damage done, and sometimes it's not even like, oh, it breaks a tooth in the moment, but more of just consecutive ice chewing and what that can do to our teeth and enamel in the long run. So definitely recommend staying away from hard ice chewing. Something else that happens a lot during that third trimester is heartburn. Some people experience it throughout their entire pregnancies, but I personally get it during that last bit. And you can get like a hiatal hernia. That's actually something I've had from pregnancy before, which makes you even more likely to have more heartburn. And sometimes heartburn doesn't feel like acid. Sometimes it just feels like pressure or pain in the chest. It's something that is serious. I feel like it's written off sometimes for just like, oh, it's another pregnancy side effect. But the seriousness lies in the fact that you have stomach acid coming back into your esophagus area or back into your mouth. That stomach acid is so acidic. It is so bad for our teeth. I mean, we're talking way worse than acidic beverages and things like that. This stuff can eat through your teeth really quickly. So it's really important. It's something that we want to know about as your dental care providers for sure, but it's also something you should talk to your healthcare providers, midwives, or OBs about best ways to combat it. Because sometimes it's different for different people and they'll have different recommendations for you. There are some healthy alternatives to Tums and things like that. So definitely recommend treating your heartburn if you have it. Also recommend propping. So when you are sleeping, napping, things like that, to try to not do completely horizontal. When we're this pregnant, you're not supposed to lay on your back anyways, for the most part. So propping a little bit can help a ton with heartburn not reaching our mouth. So that's something to consider if you can comfortably do that, propping yourself up a little bit. That's also something that can help with some other problems that we have during sleep during the third trimester, but that acid is just a really important one that I always want to address in the third trimester. Other things, the sleep-related things that happen during third trimester, is one of my biggest complaints of pregnancy is not great sleep. I have definitely reached the insomnia phase. I am waking up almost every hour, and not getting really consistent, good, deep sleep has some issues. And that issue is that we are in and out of a lighter sleep stage. When that happens, that's the time in which we are most likely to do some of our clenching and grinding. When you are in your REM sleep cycle, you are not in a deep sleep. That's when our muscles are most relaxed and we're less likely to be doing some of the clenching and grinding and things that a lot of us do while we're sleeping. If you are coming in and out of light sleep over and over again, which will carry on through your fourth trimester because you'll have to be getting up and with baby and things like that, that is the time we see really a heightened amount of clenching and grinding and tooth-related issues because of clenching and grinding. Propping is something that can help with breathing, airway space. Again, clenching and grinding can also be caused from lack of airway space. It's our body's kind of natural reaction to try to wake up a little bit. And those two things are so related, lack of airway space and clenching and grinding our teeth. It is something that we look for when we're trying to diagnose sleep apnea in our patients, things like that. And in pregnancy, you can develop sleep apnea. We hope that it doesn't stick around. We hope that it is something that will go away after you're not pregnant anymore. But just like you can develop sleep apnea if you gain a lot of weight, the gaining of weight during pregnancy and that weight of the fetus on our body and on our diaphragm and just the overall swelling of our body will make our airway space smaller. So you're more likely to snore, you're more likely to clench and grind, you're more likely to have strange episodes when you're sleeping. I think I've talked about wearables before, but like I have the Oura Ring, or if you have a Whoop, you can really monitor that and see if you are every night having some sleep disturbances. Talk to your doctor about it. There are some temporary oral devices you can wear if you're snoring a lot, not sleeping well, waking up frequently, those sort of things. There are some devices that you can make as a temporary sleep aid to help you combat some of that snoring. Oxygen's obviously super important to you and baby, and so we want to make sure that even more so than teeth, we care greatly about how much oxygen your body is getting during this time. So that's just a really important one that's worth talking about during this third trimester phase. We also, if it is just grinding that we're experiencing, things like that, temporary or good long-term night guards, retainers, talking mouth taping. There's a lot we can do, kind of case to case. It's going to be different for everyone. So it's something we would just want to discuss with you of what your experiences are. Keeping kind of a nightly journal before your appointment can be really helpful for us to assess what that looks like for you. Those are some of the major topics of like strange diagnosis things that can happen during the third trimester that I wanted to cover. And then the last thing I wanted to cover on this series was kind of creating your birth plan and why that can affect your teeth health. Oftentimes, plans, we make them and they change. So I always say being prepared for anything that can happen is a good idea. And I think during the planning of your birth phase, the thing that creates the most change in your baby's health is how we deliver our babies. So a vaginally delivered baby is actually exposed to a lot more bacteria, good bacteria, vaginal bacteria through mom's canal. And when they're exposed to that and their oral microbiome is exposed to that, there are so many studies that have come out in the last 5+ years about how much that population of bacteria will help improve gut health for the infant, will help improve oral health for the infant. That biodiversity, or having a more diverse area of biome in the mouth, is so important for health. C-sections often cannot be avoided, sometimes scheduled. Obviously, getting baby here safely is the best plan of anybody's pregnancy. So if you do have to have a C-section, there are also a lot of studies being done on something called like vaginal seeding, vaginal bacteria transfer. There's a lot of different ways, I think a lot of different names for this, but what it means is transferring some of the microbiome from mom into baby right after they're born. So the studies that I have found and the research I've done personally has been a little mixed. There have been double-blind studies done that says vaginal seeding may not work as well as we had hoped it would. Getting better bacteria into baby's mouth might be harder than we thought. And then I've read a lot of studies that said actually we notice a major change in infants pooping and all of their digestive issues and things like that when vaginal seeding is done after C-section. So This is something that is personal choice, obviously, but some information that's just harder to come by, and something I like to talk to people about because it is so interesting. And if you are into the world of microbiomes, this is a really important way to set the foundation of health for your infant, is understanding and knowing what you can do for them in their first few days of life. So again, not a consideration you have to make if you are able to have a vaginal birth. Baby will get that vaginal biome and have it already. But if they are born via C-section, it's something to consider and something to talk to your providers about. I hope all your providers know about it. If they don't, find a provider who does, because this is some really cool way to, again, be a part of making a healthy baby. I think that's all I have for third trimester stuff. This is a 4-part series, meaning after baby gets here, we will do a 4th trimester, or what postpartum looks like and how that relates to our oral health. So stay tuned for that bit. Really, it's weird to be in a 3rd trimester and be excited about 4th trimester, but as many moms know, you get uncomfortable enough that trimester sounds lovely. So reach out with questions. We're here for them. Thanks so much.